Psychiatry, more than other areas of medicine, has struggled in that we rely on clinical interviews. So we struggle in that we don't have objective markers like a blood pressure or a temperature to measure how severe psychiatric illnesses are, what kind of psychiatric illness a patient presents with, and how to personalize treatments better with basically some kind of physiologic marker, genetic measure to match the best treatment at the best time for the particular patient. And I want to reiterate how important biomarker research is for child psychiatry, both from a clinical perspective and research perspective, in that we hope that this approach through genomic work, neuroimaging, neurophysiology work that I'm very interested in will one day better classify mental illness in children and adolescents and arm us with the tools to better match treatments to children and adolescents to optimize their life and care. The research that I'll be presenting at ACAP involves what's called single impaired pulse transcranial magnetic stimulation measures of the motor cortex. This is an indirect way to study with both a magnetic stimulator and EMG measures, electromyography measures, what's called cortical excitability and inhibition, which these are indirect measures of two very important brain chemicals, glutamate and GABA. We think that these chemicals play a role in many psychiatric illnesses in adults and children. Little is known about the role from the developmental perspective and the role they play in adolescent mood disorders, for instance. With these measures, we've been able to demonstrate that there are differences in depression, and that, for instance, if we were to measure at baseline, one study we were able to measure at baseline children starting a standard medication for depression and demonstrate baseline differences from those who responded to the medicine compared to those who did not. The other symposium is basically an overview of transcranial magnetic stimulation biomarker research in child and adolescent psychiatry. So along with Dr. Chris Wall here at Mayo Clinic, we will talk about our joint work in depression. Other presenters will include detailed research efforts involving autism with this kind of technology as well. And then another senior researcher from University of Toronto, Cam H., will discuss his nearly 2 decades of research with TMS and paradigms involving EEG and neuroimaging techniques. The hope is that this kind of clinical research and the knowledge gleaned from this could also be given to basic scientists to work further with animal models to develop maybe new approaches, more efficient treatments. We hope that eventually these RTMS studies we talked about, that we'll use this sort of a study to perfect and personalize how RTMS is delivered for both adolescents and adults. We have a long way to go and much work to do, but it's very, very exciting.